You must see this. Do you want this to happen to your penis? What happens to men when they stop having sex? Effects of abstinence. Welcome to our channel dedicated to men's health and well-being. Today we're diving into a topic that affects many men, especially as they age, the impacts of sexual abstinence on male health. Whether you're single, in a relationship, or just curious about how your body works, this information is crucial for maintaining optimal health and vitality. As we age, our bodies undergo numerous changes, and our sexual health is no exception. It's a natural part of life, but understanding these changes can help us navigate them more effectively. So, let's talk about what happens to your body during periods of sexual inactivity, and why maintaining a healthy sex life can be beneficial for men over 60. First, let's address the elephant in the room. It's perfectly normal to experience changes in your sexual activity as you get older. Life circumstances, health conditions, or simply personal choice can lead to periods of abstinence. The important thing is to understand how these periods might affect your overall health and well-being. Now, let's start with our first topic, the production and recycling of sperm. Many men wonder what happens to sperm when they're not ejaculated regularly. The truth is, your body is a marvel of efficiency. Sperm production is a continuous process that occurs in the testicles. On average, it takes about 74 days for sperm to fully mature. But what happens if these sperm aren't released through ejaculation? Contrary to popular belief, sperm doesn't just build up indefinitely. Your body has a natural recycling system in place. When sperm cells reach the end of their life cycle, typically about 5 to 6 weeks, they're reabsorbed by your body through a process called phagocytosis. This process is carried out by specialized cells in your body that break down and recycle the components of the unused sperm cells. This natural recycling process ensures that your body maintains a balance, preventing any potential issues from sperm buildup. It's a testament to the incredible efficiency of the human body. However, it's worth noting that regular ejaculation, whether through sexual activity or masturbation, can help maintain the health of your reproductive system. To keep your reproductive system in good shape, it's beneficial to maintain some level of sexual activity. This doesn't necessarily mean frequent intercourse. Even masturbation can be beneficial. It helps to keep the entire system in practice, so to speak. If you're not sexually active, consider talking to your doctor about other ways to maintain your reproductive health, such as pelvic floor exercises or other activities that promote blood flow to the genital area. Moving on to our second topic, let's discuss the relationship between sexual activity and prostate health. The prostate gland plays a crucial role in male reproductive health, producing fluid that nourishes and protects sperm. As men age, the risk of prostate problems increases, making it even more important to understand how sexual activity can impact this vital gland. Research has shown that regular ejaculation may have a protective effect on prostate health. A large-scale study published in the Journal of the American Medical Association found that men who ejaculated more frequently, 21 times or more, per month, had a lower risk of prostate cancer compared to those who ejaculated less frequently, 4 to 7 times per month. However, it's important to note that this doesn't mean that abstinence directly causes prostate problems. Many factors contribute to prostate health, including diet, exercise, and genetics. Regular ejaculation is just one piece of the puzzle. If you're experiencing a period of abstinence, there are other ways to promote prostate health. Maintaining a healthy diet rich in fruits, vegetables, and whole grains can be beneficial. Foods high in lycopene, such as tomatoes, have been associated with lower prostate cancer risk. Regular exercise, particularly activities that engage the pelvic floor muscles, can also support prostate health. It's also crucial to have regular checkups with your doctor, especially as you age. Prostate exams and PSA, prostate-specific antigen, tests can help detect any potential issues early on, when they're most treatable. Now let's move on to our third topic, libido and emotional well-being. libido, or sex drive can naturally fluctuate throughout your life, and periods of abstinence can sometimes affect it. It's a common misconception that abstinence will automatically increase your sex drive. In reality, the relationship between abstinence and libido is more complex. For some men, a period of abstinence might initially increase sexual thoughts and desires. However, if abstinence continues for an extended period, you might experience a decrease in libido. This is because sexual activity itself can stimulate the production of hormones and neurotransmitters that contribute to sexual desire. It's not just about physical desire, though. Sexual activity, whether with a partner or through masturbation, can have significant emotional and psychological benefits. It can reduce stress, improve mood, and contribute to overall emotional well-being. Regular sexual activity has been linked to the release of endorphins, often called feel-good hormones, which can help combat feelings of depression and anxiety. During periods of abstinence, it's important to find other ways to maintain emotional well-being. This could include regular exercise, which can also boost endorphin levels, or engaging in hobbies and activities that bring you joy and satisfaction. Maintaining social connections is also crucial for emotional health, especially as we age. If you're finding that abstinence is affecting your emotional well-being, consider speaking with a mental health professional. They can provide strategies to cope with any negative feelings and help you maintain a positive outlook on life, regardless of your current sexual activity level. Remember, there's no normal amount of sexual activity. What's important is finding a balance that works for you and supports your overall health and happiness. Whether you're sexually active or not, prioritizing your emotional well-being is crucial for a fulfilling life. Now, let's delve into our fourth topic: erectile function and blood circulation. As men age, changes in erectile function are common and can be a source of concern. Understanding how abstinence might affect this aspect of your health is crucial for maintaining overall sexual well-being. Erections are primarily a matter of blood flow. When sexual arousal occurs, blood vessels in the penis dilate, allowing more blood to flow into the erectile tissues. This increased blood flow causes the penis to become erect. The ability to achieve and maintain an erection depends on various factors, including the health of your blood vessels, nerves, and hormones. During periods of sexual abstinence, you might notice changes in the frequency or quality of your erections. Some men report experiencing fewer spontaneous erections or morning wood when they're not sexually active. This doesn't mean that your erectile function is permanently diminished, but rather that your body may be adapting to the lack of sexual stimulation. It's important to note that regular erections, whether through sexual activity or nocturnal erections during sleep, play a crucial role in maintaining the health of erectile tissues. These erections bring oxygen-rich blood to the penis, which helps keep the tissues healthy and elastic. Without regular erections, there's a risk of tissue atrophy, which could potentially lead to difficulties with erectile function in the future. However, this doesn't mean you need to panic if you're going through a period of abstinence. Your body has natural mechanisms to maintain erectile health, such as nocturnal erections. Most men experience several erections during sleep, even if they don't remember them upon waking. These involuntary erections help maintain the health of erectile tissues. To support your erectile health during periods of abstinence, there are several steps you can take. First and foremost, focus on maintaining good overall cardiovascular health. What's good for your heart is generally good for your sexual function. This includes regular exercise, particularly aerobic activities that get your blood pumping, such as brisk walking, swimming, or cycling. A healthy diet is also crucial. Foods that support cardiovascular health, such as fruits, vegetables, whole grains, and lean proteins, can also benefit your sexual health. Some studies suggest that certain foods, like dark chocolate, nuts, and watermelon, may have specific benefits for erectile function due to their nutrient content. Kegel exercises, which strengthen the pelvic floor muscles, can also be beneficial for erectile function. These exercises involve contracting and relaxing the muscles that control urination. Regular practice can improve blood flow to the genital area and may enhance erectile function. Stress management is another important factor. High levels of stress and anxiety can interfere with sexual function, so finding effective ways to relax and unwind is crucial. This could include practices like meditation, yoga, or simply setting aside time for activities you enjoy. If you're concerned about changes in your erectile function, whether during periods of abstinence or not, it's always a good idea to consult with your healthcare provider. They can help determine if there are any underlying health issues and suggest appropriate treatments or lifestyle changes. Moving on to our fifth topic, let's discuss hormone levels and testosterone. Testosterone is often called the male sex hormone, and it plays a crucial role in various aspects of men's health, including sexual function, muscle mass, bone density, and overall energy levels. There's a common misconception that sexual abstinence leads to increased testosterone levels. However, the relationship between sexual activity and testosterone levels is more complex than that. While short-term abstinence, about a week, might cause a slight increase in testosterone levels, long-term abstinence doesn't necessarily lead to sustained higher levels. In fact, regular sexual activity has been associated with maintaining healthy testosterone levels, especially in older men. This doesn't mean you need to be sexually active to maintain normal testosterone levels, but it does suggest that sexual activity can be part of a healthy lifestyle that supports hormone balance. As men age, it's natural for testosterone levels to gradually decline. This can lead to various symptoms, including reduced libido, erectile difficulties, decreased muscle mass, and changes in mood or energy levels. However, it's important to note that these changes are gradual and vary greatly from one individual to another. To support healthy testosterone levels, regardless of your level of sexual activity, there are several steps you can take. Regular exercise, particularly strength training and high-intensity interval training, has been shown to boost testosterone levels. These types of exercises stimulate muscle growth and hormonal responses that can benefit overall testosterone production. Diet also plays a crucial role. Ensuring you get enough protein is important for testosterone production. Foods rich in zinc, such as oysters, beef, and pumpkin seeds, may also support testosterone levels. Some studies suggest that vitamin D might play a role in testosterone production, so getting enough sunlight or considering vitamin D supplements, under medical supervision, could be beneficial. Adequate sleep is another key factor. Most testosterone release occurs during sleep, so aim for 7 to 9 hours of quality sleep each night. Creating a consistent sleep schedule and a relaxing bedtime routine can help improve your sleep quality. Stress management is equally important. Chronic stress can lead to elevated cortisol levels, which may interfere with testosterone production. Finding effective ways to manage stress, whether through exercise, meditation, or engaging in enjoyable activities, can help maintain hormonal balance. If you're concerned about your testosterone levels, it's important to consult with your healthcare provider. They can perform blood tests to check your hormone levels and, if necessary, discuss treatment options. However, it's crucial to remember that testosterone replacement therapy isn't suitable for everyone and should only be considered under close medical supervision. Now, let's move on to our sixth topic: wet dreams and sleep cycles. Wet dreams, also known as nocturnal emissions, are a natural occurrence where a man ejaculates during sleep. They're most common during adolescence and early adulthood, but can occur at any age, including in older men. During periods of sexual abstinence, you might experience an increase in wet dreams. This is your body's natural way of releasing built-up semen and maintaining reproductive health. It's important to understand that wet dreams are entirely normal and not a cause for concern. Wet dreams typically occur during the rapid eye movement, REM stage of sleep. This is the stage where most dreaming happens, and it's characterized by increased brain activity, faster breathing, and temporary paralysis of the major muscle groups. The exact mechanism that triggers wet dreams isn't fully understood, but it's believed to be related to the natural cyclical changes in hormone levels during sleep. The frequency of wet dreams can vary greatly from person to person. Some men may experience them regularly, while others may rarely or never have them. The frequency often decreases with age, but this isn't universal. If you're experiencing wet dreams, regardless of your age, it's simply a sign that your reproductive system is functioning normally. It's worth noting that the content of dreams associated with nocturnal emissions isn't always sexual in nature. Sometimes men may not even remember dreaming at all. The important thing to remember is that wet dreams are involuntary and not a reflection of your thoughts or desires. To maintain good sleep hygiene, which can indirectly affect the frequency of wet dreams, try to establish a regular sleep schedule. Go to bed and wake up at consistent times, even on weekends. Create a relaxing bedtime routine to help you unwind before sleep. This might include reading a book, listening to calming music, or practicing relaxation techniques like deep breathing or progressive muscle relaxation. Now, let's move on to our 7th topic: masturbation and sexual health. This is a subject that many people, especially older adults, might feel uncomfortable discussing. However, it's an important aspect of sexual health that deserves attention and understanding. Masturbation is a normal and healthy sexual activity that can be beneficial at any age. It's a way to express sexuality, experience pleasure, and maintain sexual function, especially during periods when you're not sexually active with a partner. For older men, masturbation can help maintain erectile function and overall sexual health. There are several health benefits associated with masturbation. It can help reduce stress and tension, improve sleep quality, and even provide pain relief. For some individuals, masturbation also helps you stay in touch with your body and understand your sexual responses, which can be particularly valuable as you age and your body undergoes changes. From a physical health perspective, regular masturbation can help maintain the health of your reproductive system. It promotes blood flow to the genital area, which is beneficial for erectile function. For men with enlarged prostates, some studies suggest that regular ejaculation through masturbation might help alleviate symptoms, although more research is needed in this area. It's important to dispel some common myths about masturbation. Contrary to old wives' tales, masturbation does not cause physical harm, sexual dysfunction, or mental health problems. It doesn't lead to infertility or impact your ability to have sex with a partner. These are all unfounded myths that have no basis in scientific fact. However, like any activity, masturbation should be practiced in moderation. If it begins to interfere with your daily life, relationships, or overall well-being, it might be worth discussing with a healthcare provider or a sex therapist. They can provide guidance and ensure that your sexual practices are healthy and positive. For those who choose to masturbate, it's important to practice good hygiene. Always wash your hands before and after the activity. If you use any sex toys, make sure to clean them thoroughly according to the manufacturer's instructions. This helps prevent any potential infections or irritations. Remember, there's no normal frequency for masturbation. Some people may do it daily, while others may do it rarely or not at all. What's important is that you feel comfortable with your choices and that your sexual practices contribute positively to your overall health and well-being. If you're in a relationship, open communication with your partner about sexual needs and practices, including masturbation, can lead to a healthier and more satisfying sex life. Many couples find that mutual masturbation can be a fulfilling part of their sexual repertoire, especially as they age and may face challenges with traditional intercourse. Now, let's transition to our 8th topic: preventing sexually transmitted diseases, STDs, and urinary tract infections, UTIs. While periods of sexual abstinence can reduce the risk of contracting STDs, It's crucial to understand that the risk doesn't disappear entirely, especially if you decide to become sexually active again. STDs can affect people of all ages, including older adults. In fact, rates of STDs among older adults have been increasing in recent years. This is partly due to people living longer, more active lives, and partly due to a lack of awareness about STD risks in this age group. If you're considering becoming sexually active after a period of abstinence, it's important to take precautions. Always use barrier methods like condoms, even if pregnancy is no longer a concern. Condoms are highly effective at preventing the transmission of many STDs, including HIV, chlamydia, and gonorrhea. It's also crucial to have open and honest conversations with new sexual partners about sexual health. Discuss your sexual histories and consider getting tested for STDs together. Before becoming intimate, remember, many STDs can be asymptomatic, meaning you or your partner could be infected without knowing it. Regular STD testing is important for sexually active individuals of all ages. Don't assume that your doctor will automatically test you for STDs during your regular checkups. Be proactive and ask for these tests if you're sexually active or planning to become sexually active. Urinary tract infections, UTIs, are another concern, particularly for older adults. While sexual activity can increase the risk of UTIs, especially in women, periods of abstinence don't eliminate the risk entirely. UTIs can occur due to various factors, including changes in the urinary system that come with age. To reduce the risk of UTIs, it's important to maintain good hygiene practices. This includes urinating before and after sexual activity, wiping from front to back after using the toilet, and staying well hydrated. Some people find that cranberry products can help prevent UTIs, although scientific evidence on this is mixed. If you experience symptoms of a UTI, such as a frequent urge to urinate, burning sensation during urination, or cloudy urine, seek medical attention promptly. UTIs can be more serious in older adults and may lead to complications if left untreated. Now, let's discuss our 9th topic, ejaculation and prostate health. This is an area where there's been a lot of research and some interesting findings in recent years. Several studies have suggested that frequent ejaculation may be associated with a lower risk of prostate cancer. One large-scale study found that men who ejaculated 21 or more times per month had a lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. However, it's important to note that this doesn't establish a cause and effect relationship, and other factors like diet, exercise, and genetics also play significant roles in prostate cancer risk. The potential protective effect of frequent ejaculation on prostate health is thought to be due to the prostatic stagnation hypothesis. This theory suggests that carcinogens may build up in the prostate if fluids aren't cleared out regularly through ejaculation. By ejaculating frequently, you may be flushing out these potential cancer-causing agents. However, it's crucial to understand that this doesn't mean you need to force yourself to ejaculate if you're not feeling the desire. Sexual activity, including ejaculation, should be a natural and enjoyable part of life, not a chore done solely for health reasons. For men who are experiencing a period of sexual abstinence, whether by choice or circumstance, there's no need to worry that you're automatically increasing your risk of prostate problems. The relationship between ejaculation frequency and prostate health is just one of many factors that contribute to overall prostate health. Other important factors for maintaining prostate health include maintaining a healthy diet rich in fruits and vegetables, getting regular exercise, not smoking, and limiting alcohol consumption. Regular checkups with your healthcare provider, including prostate exams when recommended, are also crucial for early detection of any potential issues. It's also worth noting that while frequent ejaculation may have potential benefits, there's no evidence to suggest that refraining from ejaculation, sometimes called semen retention, has any health benefits. Some people practice semen retention for personal or spiritual reasons, but from a medical perspective, There's no known advantage to deliberately avoiding ejaculation. If you have any concerns about your prostate health or sexual function, it's always best to discuss these with your healthcare provider. They can provide personalized advice based on your individual health status and risk factors. Now, let's move on to our 10th and final main topic: mental health and sexual life. The connection between our mental well-being and our sexual health is profound and multifaceted, especially as we age. Understanding this relationship can help us maintain a healthier, more satisfying life overall. As we get older, various life changes can impact both our mental health and our sexuality. Retirement, changes in physical health, loss of loved ones, and shifts in relationships can all play a role. It's important to recognize that these changes are normal parts of aging, but they can still have significant effects on our emotional and sexual well-being. During periods of sexual abstinence, whether voluntary or due to circumstances, some men may experience feelings of loneliness, depression, or anxiety. These feelings are valid and should not be ignored. It's crucial to remember that your worth is not determined by your sexual activity, and there are many ways to find fulfillment and connection in life. On the flip side, maintaining good mental health can positively impact your sexual health. When you're feeling emotionally balanced and content, you're more likely to have a healthy libido and enjoy sexual experiences when they occur. This is partly due to the complex interplay of hormones and neurotransmitters in our bodies that affect both our mood and our sexual function. If you're struggling with mental health issues, it's important to seek help. This could be through talking to a trusted friend or family member, joining a support group, or seeking professional help from a therapist or counselor. Many people find that cognitive behavioral therapy, CBT, can be particularly helpful in addressing issues related to sexuality and aging. For those in relationships, open communication with your partner about your feelings, needs, and concerns is crucial. Many couples find that their intimate relationship evolves as they age, and that's perfectly normal. Finding new ways to express affection and maintain emotional intimacy can help keep your relationship strong, even if the physical aspects change. It's also worth noting that intimacy doesn't always have to involve sexual intercourse. Holding, hands, hugging, kissing, and other forms of physical affection can provide emotional comfort and strengthen bonds. For many older adults, these forms of intimacy become increasingly important and satisfying. Mindfulness practices can be beneficial for both mental health and sexual well-being. Techniques like meditation and deep breathing exercises can help reduce stress and anxiety, which in turn can improve sexual function and satisfaction. These practices can also help you stay present in the moment during intimate experiences, enhancing your enjoyment and connection with your partner. Engaging in regular physical activity is another powerful tool for maintaining both mental and sexual health. Exercise releases endorphins, which can improve mood and reduce stress. It also improves cardiovascular health and blood flow, which are crucial for sexual function. Activities like yoga or Tai Chi can be particularly beneficial with mindfulness.
Maintaining social connections is also vital for mental health, especially as we age. Loneliness and social isolation can have
negative impacts on both mental and physical health, including sexual health. Stay engaged with friends and family, participate in community activities, or consider volunteering. These social connections provide emotional support and can help maintain a positive outlook on life. If you're single and interested in starting a new relationship, don't let age hold you back. Many older adults find loving, fulfilling relationships later in life. Online dating platforms designed for seniors can be a good way to meet like-minded individuals. Just remember to prioritize your safety and take things at a pace that feels comfortable for you. It's also important to address any feelings of shame or embarrassment about sexuality that may have developed over the years. Many older adults grew up in times when discussions about sex were taboo, which can lead to lingering discomfort with the topic. Remember, Sexuality is a normal, healthy part of life at any age. If you're struggling with these feelings, talking to a sex therapist or counselor who specializes in senior sexuality can be incredibly helpful. For those dealing with age-related changes in sexual function, such as erectile difficulties or decreased libido, it's crucial to approach these issues with a positive, problem-solving attitude. Many of these challenges can be addressed through lifestyle changes, medication, or therapy. Don't hesitate to discuss these concerns with your healthcare provider. They can provide valuable advice and treatment options. Remember, sexual health is just one aspect of overall health and well-being. While it's important, it doesn't define your worth or your ability to lead a fulfilling life. Many older adults find that with age comes a deeper appreciation for other forms of intimacy and connection. As we wrap up our discussion on mental health and sexual life, I want to emphasize the importance of self-compassion. Be kind to yourself as you navigate the changes that come with aging. Celebrate your body and all that it has carried you through over the years. Embrace the wisdom and experience you've gained, and let that inform your approach to sexuality and relationships. Now, let's take a moment to recap the key points we've covered in this video. We've discussed how sexual abstinence can affect various aspects of men's health, from sperm production and prostate health to hormone levels and mental well-being. We've explored the importance of maintaining overall health through diet, exercise, and regular checkups. We've addressed the benefits of maintaining sexual activity, whether with a partner or through masturbation, while also acknowledging that periods of abstinence are normal and can be managed healthily. We've debunked myths and provided factual information about topics that are often misunderstood, such as the effects of ejaculation on prostate health and the normalcy of wet dreams at any age. We've stressed the importance of safe sex practices and regular STD testing for sexually active individuals. And importantly, we've highlighted the strong connection between mental health and sexual well-being, encouraging open communication, mindfulness, and self-compassion. Remember, every individual's journey is unique. What works for one person may not work for another. The key is to stay informed, maintain open communication with your healthcare providers and partners, and make choices that feel right for you and your health. As we age, our bodies and our sexualities evolve, but that doesn't mean we can't continue to lead fulfilling, healthy lives. Embracing these changes with a positive attitude, staying proactive about your health, and maintaining connections with others can lead to a rich and satisfying life, regardless of your level of sexual activity. Before we conclude, I want to remind you that if you're experiencing any concerns about your sexual or overall health, don't hesitate to speak with a healthcare professional. They can provide personalized advice and treatment options based on your individual needs and circumstances. Thank you for staying with us through this comprehensive discussion on men's sexual health and the impacts of abstinence. Your commitment to understanding and caring for your health is commendable. As we wrap up our conversation, let's take a moment to reinforce some key points and provide some final thoughts on maintaining overall health and well-being. First and foremost, it's crucial to remember that your sexual health is an integral part of your overall health. Just as you wouldn't ignore issues with your heart or your lungs, it's important not to neglect your sexual health. Regular checkups with your healthcare provider should include discussions about your sexual health, especially as you age. Don't be embarrassed to bring up concerns or ask questions. Your doctor is there to help you maintain your health in all aspects. We've discussed how periods of sexual abstinence can affect various aspects of your health, from your reproductive system to your mental well-being. Remember, whether you're sexually active or not, there are always steps you can take to maintain your health. Regular exercise, a balanced diet rich in fruits and vegetables, adequate sleep, and stress management are all crucial components of a healthy lifestyle that supports both your overall and sexual health. For those who are sexually active, we can't stress enough the importance of safe sex practices. Regardless of your age, if you're engaging in sexual activity with a new partner, use protection. Sexually transmitted infections don't discriminate based on age, and prevention is always better than treatment. Regular STD testing is also important, especially if you have multiple partners or are starting a new relationship. We've also touched on the importance of mental health and its connection to sexual well-being. As you age, it's normal to experience changes in your mood, your relationships, and your sexual desires. These changes don't have to be negative. Many people find that with age comes a deeper appreciation for intimacy and connection. However, if you're struggling with feelings of depression, anxiety, or loneliness, don't hesitate to seek help. Mental health professionals can provide valuable support and strategies to help you navigate these challenges. Remember, there's no normal when it comes to sex and aging. Some people maintain an active sex life well into their golden years, while others may find that their desires change or diminish. Both are perfectly acceptable. What's important is that you feel comfortable and satisfied with your life, whatever that means for you. For those in relationships, communication is key. As your body changes and your needs evolve, it's crucial to maintain open and honest dialogue with your partner. This can lead to a deeper understanding and often a more satisfying, intimate relationship. Remember, intimacy isn't just about sexual intercourse. Holding hands, cuddling, and other forms of physical affection can be just as important for maintaining a strong bond. If you're single, know that it's never too late to form new relationships or explore your sexuality. Many older adults find love and companionship later in life. Just remember to approach new relationships with caution and prioritize your safety and well-being. We've discussed the potential benefits of regular sexual activity, including possible positive effects on prostate health and overall well-being. However, it's equally important to remember that these benefits don't mean you should feel pressured to be sexually active if you don't want to be. Your body, your choices. What's most important is that you feel comfortable and happy with your decisions. For those experiencing sexual difficulties, whether related to erectile function, libido, or any other aspect, remember that there are often solutions available. Medical advancements have provided various treatment options for many age-related sexual issues. Don't be afraid to discuss these with your healthcare provider. They can guide you towards the most appropriate solutions for your individual situation. We've also touched on the topic of masturbation, which remains a healthy and normal practice at any age. It can help maintain sexual function, relieve stress, and provide pleasure. If it's something you're comfortable with, know that it's a perfectly acceptable way to express your sexuality, whether you're in a relationship or not. As we age, it becomes increasingly important to pay attention to our overall health. Conditions like diabetes, heart disease, and high blood pressure can all impact sexual function. By managing these conditions through proper medical care, diet, and exercise, you're not only improving your overall health but potentially your sexual health as well. Remember the importance of self-care and self-compassion. Treat your body with kindness and respect. Celebrate what it can do rather than focusing on limitations. Practice gratitude for the experiences you've had and the wisdom you've gained over the years. This positive mindset can have profound effects on both your mental and physical well-being. Stay socially active and engaged with your community. Loneliness and isolation can have negative impacts on both mental and physical health. Participate in activities you enjoy, volunteer, or join clubs or groups that interest you. These social connections can provide emotional support, mental stimulation, and a sense of purpose, all of which contribute to overall well-being. Consider incorporating mindfulness practices into your daily routine. Techniques like meditation, deep breathing exercises, or even mindful walking can help reduce stress, improve mood, and enhance overall quality of life. These practices can also help you stay present and engaged during intimate moments, potentially enhancing sexual experiences. Don't underestimate the power of laughter and joy in your life. Engage in activities that bring you happiness, whether that's spending time with loved ones, pursuing a hobby, or simply enjoying a good book or movie. A positive outlook can have significant benefits for both your mental and physical health. As we conclude this discussion, I want to emphasize that aging is a natural and beautiful part of life. It brings with it challenges, yes, but also opportunities for growth, deeper connections, and new experiences. Your sexual health is just one aspect of your overall well-being, but it's an important one that deserves attention and care. Remember, you are not alone in navigating these changes. There are healthcare professionals, counselors, and support groups available to help you through any challenges you may face. Don't hesitate to reach out for support when you need it. Thank you for taking the time to learn about this important aspect of health. By educating yourself and staying proactive about your well-being, you're taking important steps towards a healthier, more fulfilling life. Remember, it's never too late to prioritize your health and happiness. Before we end, I'd like to encourage you to continue seeking out reliable information about your health. If you found this video helpful, please consider subscribing to our channel. We regularly post content on various health topics relevant to older adults. Your support helps us continue providing valuable information to our community. Also, we'd love to hear from you. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. Your feedback helps us create content that's most useful to you. Remember, every step you take towards better understanding and caring for your health is a step towards a better quality of life. Whether you're sexually active or not, your worth is not defined by your sexual activity, but by the fullness of your life and the kindness you show to yourself and others. Thank you for watching, and here's to your health and happiness. Until next time, take care and be well.